Afternoon, everyone. This is Dr. Sujata Charles, a consultant from the Lotus Hospital at Lakdi Kapul. We at Lotus Hospital believe in not only taking care of our patients but also educating the public about various health issues. Hence, this talk on cervical cancer prevention and screening. I know talking about cancer is not a very nice thing, but the best part of this talk is that cervical cancer, a cancer of the mouth of uterus, is a preventable cancer. So I would like you to take you through the steps of how this cancer can be prevented. So first I will start with the female genital tract. As all of you know, we have the external genitalia or the sexual organs and the internal organs. The internal organs consist of the uterus or the womb, and there are two tubes on either side, the right side and the left side, with the corresponding ovaries. And then the uterus opens into the vagina or the birth canal through the cervix, which is called the mouth of the uterus. So today my talk will be about the cervical cancer. So why is this very important? Cervical cancer accounts for around 23% of all the cancers of women, and it is the third largest cause of deaths due to cancer, and the mean age at which a woman can be affected is 38 years. The range is from 21 to 67. As I told you earlier, cancer of the cervix can be prevented by screening and finding it at an early stage, because the changes or the precancerous lesions which occur take at least around 10 years to develop into cancer. So we have an opportunity to detect them if a woman is screened regularly. So how does one diagnose cervical cancer? So what does the lady present with? Usually it is bleeding irregularities like either heavy bleeding, bleeding in between periods, bleeding after an intercourse, or in a postmenopausal woman, she can present with bleeding. Sometimes some women complain of pelvic pain, a pain lower down, or pain after intercourse. And there may be, in the later stages, loss of weight and appetite. So what does one find when a woman comes and is examined by a doctor? As I told you, the neck of the womb or the cervix will be looking unhealthy, and it can bleed on touch. Sometimes we might even see a growth on the cervix. So the best part of this cancer of the cervix is that it is caused by a virus which is called the human papillomavirus. In around 90% of the patients, there will not be any symptoms, and in most of the women, the infection disappears within 2 years, depending on the immunity of the mother. However, if the infection persists, and the infection is got due to contact or through intercourse, the intercourse could be a vaginal intercourse, or could be a oro-vaginal intercourse, or a anal intercourse. So if the infection persists, then it can cause warts in the skin or in the mucous tissues of the vagina, on the cervix, or near the mouth. Or can lead to the development of precancerous lesions, which in our terminology it's called cervical intraepithelial neoplasia. So there are various stages of the precancerous lesions. We call it CIN1, where only 1/3 of the mucus layer is involved, and then it progresses to CIN2, where 2/3 of the skin thickness or the mucus thickness is involved. Later on, it goes to CIN3, where the entire mucus thickness is involved, and then it transitions or it progresses to cancer inside the layer, which is called cancer in situ, and if it is not treated, it progresses to cancer of the cervix. So, I have explained to you about the precancerous lesion. So, what are the risk factors? The first risk factor is infection with the human papillomavirus. Then it could be an early age of coitus, which is very common in our population, where girls get married between 16 and 18 years. Having intercourse with different partners, history of sexually transmitted infections, any immunodeficient conditions like malnourishment, HIV, or anything which causes one's immunity to decrease also can cause this virus to stay on in the tissues and cause the precancerous lesion. Smoking is another risk factor which has to be taken care of. So, how do we prevent? So, prevention can be of three types. Primary prevention, that is, I have explained to you the risk factors, avoiding the risk factors. You cannot stop a woman from getting married young, but at least we can advise them to use condoms till they want to have a child. Treating the sexually transmitted infections. So that also helps in the human papillomavirus or the HPV virus infection to disappear from the tissues. Not having different partners also is another primary prevention. Then we have the vaccines. The HPV vaccine has been developed to take care of the type of viruses which can cause either the warts or the cancers. So, two types of vaccines are in the market. One is the bivalent vaccine, which helps the woman to develop immunity against HPV 16 and 18, which is responsible for around 70 to 80% of the cervical cancers. I must tell you that HPV virus not only causes cancer of the cervix, vulva or vagina in the woman, it can cause cancer of the penis or cancer of the mouth or the oropharyngeal area. So, the vaccines are given not only to girls but also to boys. So, that is primary prevention by avoiding the risk factors as well as prophylactic HPV vaccination. I told you about the bivalent vaccine. We have the quadrivalent. The quadrivalent vaccine covers 611 strains of the HPV virus which can cause the warts, as well as 16 and 18 which are responsible for cervical cancer. Now we have the monovalent vaccine which is effective against 5 more other strains which can cause the cervical cancer. Now coming to secondary prevention. Secondary prevention is by screening the woman for the precancerous changes in her cervix. That can be either through a pap smear or through a visual inspection with acetic acid. This pap smear, many of you might be aware of it. Many of you might have done it as a part of your gynecological examination, but it will be good for people who have never had a pap smear done to get one done. And it has been proved that doing regular pap smear once in 3 years till the age of 50 and then once in 5 years up to 65 has dramatically reduced the incidence of cervical cancer. So that is a good option. But pap smear needs a pathologist to be around, and you need some equipment which we cannot do in our rural population. So there the government has introduced the visual inspection with acetic acid. That is, when a woman comes to the center, the cervix is cleaned with acetic acid, and if there are any precancerous cells, it takes up more of this acetic acid, and the proteins get denatured and it becomes white in color. So that shows that this is an area of fistula which is inserted into the cervix, and it is rotated because the mouth of the uterus has a canal. So you have to get into a solution from where the harvest of cells are greater. HPV DNA testing is also done in the same way as a pap smear is done. So the recommendation is to do it after 30 years to look for the high risk viruses. As I mentioned, you have the quadrivalent, again 6, 11, 16 and 18. And you have the nonavalent, which has 5 more high risk viruses. Now when do we start vaccinating? In the Western countries, school children are regularly vaccinated against the HPV virus between 8 to 11 years, that is before the onset of sexual activity, only for the girls. So the boys will need to be vaccinated with the quadrivalent. And in India, we are recommending children between 9 to 14 years to have the vaccine. So if before 14 years the children are vaccinated, they need 2 doses. The second dose is these vaccines are not very cheap. So the bivalent vaccine or the Cervarix, which only the girls can get, is around 3,000 rupees per dose, and the Gardasil is around 4,000 rupees, and the Gardasil 9 or the nonavalent vaccine is around 10,000 rupees. So the government of India has come up with a new vaccine called the Cervivac, which was produced last year, but it has not yet come into the market. It is said that it costs around 400 rupees per dose. So we are looking forward to having this soon available in the market. Now, for adults, the vaccination is given up till 26 years, preferably before the onset of So now we discussed about the vaccine. So I want to tell you there are few side effects about the vaccine. If one is allergic to many other things, then it is suggested that the person does not take the vaccine. The side effects are few, like sometimes pain at the site of injection and some redness or swelling, and sometimes body ache. Otherwise, it's a very safe vaccine. Then I said about the screening by pap smear or visual inspection with acetic acid. So once you find some precancerous lesions, there are 3 types of precancerous lesions. So cervical intraepithelial neoplasia 1, or we call it CIN1, that has a very low risk of turning into cancer, around 1%. So either we can keep monitoring the woman, make sure the risk factors are avoided, like using condoms, stopping smoking, improving the immunity, and having a monogamous relationship. And in 80 to 90%, it gets resolved by itself. Whereas in CIN2 and 3, it is advised we have to remove that area which is affected because they have a greater percentage of cancer developing in these conditions. Supposing when you see the woman and unfortunately she has already crossed these precancerous lesions and developed a cancer, how do we take care of that? There are various treatment modalities. It depends on the type of tumor, the size of tumor, the stage, that means how much it has spread to the neighboring organs, and whether she has finished a family bearing. So all these factors will help us to decide what type of treatment she can be given. We have the surgical treatment, that is, we remove the uterus along with that cancer, with the tubes, ovaries, and the nearby organs. Or it's called radical hysterectomy, or radiation can be given. That is, you keep some needles inside the cervix or the uterus, and the radiation kills the cells. Then we have chemotherapy also, because like cisplatin, 5-fluorouracil, these are some agents which will sensitize the woman to radiation treatment. So that form of treatment is also available. Supposing a woman has not completed her family, you cannot remove the uterus. So what does one do? If it is in the early stage, that is just confined to the cervix, then we can remove that part of the cervix, and then we can put a stitch at the opening of the womb, so that when the woman gets pregnant, the pregnancy is able to be contained inside the uterus. So that type of management is also there. However, if a patient is detected to have cancer while she is pregnant, then it depends on the stage of the cancer. Also, the duration of pregnancy. If she is around term, and if the baby can be delivered, like after 34 weeks, the baby has a good chance of surviving outside. So immediately the baby is delivered by cesarean, and then the uterus is removed along with the tissues around. However, if it's a later stage, like stage 3 or 4, Then for the safety of the mother, the uterus is removed along with the baby inside. So I have just thrown light on few facts of cervical cancer. I know you will have lot of questions. One is, if I have cervical cancer, can my child also get? No, because this is caused by a virus, not a genetic reason causing the cancer. I am taking vaccine. Do I still have to go through the screening to see if I have precancerous changes in my cervix? Yes. Even if you have been fully immunized, you have taken either the 2 doses or the 3 doses, still it is recommended that you go through the routine screening, either in the form of pap smear or HPV DNA testing for high-risk viruses. In the Western countries, because people may not have the time to go to the clinics or the hospitals, self-test kit is available, which has not come into market in India. Clear instructions are written on the kit, how to collect the sample, and once it is collected, it is put into a bottle with a solution and sent to the clinic or the hospital where it is processed. So we believe in India also soon it will be available so that women can take care of their health properly. So I would like to stop here. I'll be available to answer all your queries if you do have. And thanks for your patient listening. And I pray that this talk would have enlightened you about cervical cancer. Thank you.